What if I told you that two people struggling to breathe could have completely different diseases? Different causes, different treatments, and very different futures. One is called asthma. The other is COPD. They sound similar. They feel similar. Welcome back to Topic Toss, the channel where we toss complex topics into simple, powerful understanding. Today's episode is one of the most important health videos you'll ever watch. Asthma versus COPD. Know the difference? By the end of this video, you will clearly understand what separates asthma from COPD. Know why misdiagnosis happens. Learn the science behind breathing. Understand the symptoms, causes, treatments, and prevention. And most importantly, know when to take action. So stay with Topic Toss till the end, because this knowledge can literally save lives. Asthma and COPD are both chronic lung diseases, meaning they affect the airways and breathing. Asthma is a chronic inflammatory disease. In asthma, your airways become inflamed, the muscles around them tighten, and they produce extra mucus. This leads to wheezing, shortness of breath, chest tightness, and coughing. The important thing to remember is that asthma is usually reversible with treatment. Airways can return to normal. It's an umbrella term mainly including chronic bronchitis and emphysema. In COPD, the airways are permanently damaged, the air sacs lose their elasticity, and air gets trapped inside the lungs. This is a crucial point. COPD is progressive and irreversible. Once the damage happens, it cannot be fully undone. Now here's a major difference many people overlook. Age and origin. Asthma is the early starter. It often begins in childhood or the teenage years and is strongly linked to genetics, allergies, and family history. Sometimes, it can even improve or disappear in adulthood. COPD is the late developer. It usually develops after the age of 40 and takes years or even decades to appear, with symptoms worsening slowly over time. COPD isn't sudden. It's the result of long-term lung damage. In asthma, the immune system overreacts to harmless things. It's like a fire alarm that goes off when someone makes toast. The causes of COPD, however, are primarily from toxic exposure. Smoking is responsible for about 80 to 90% of cases. Other causes include secondhand smoke, air pollution, and occupational dust. COPD isn't an immune overreaction. It's a long-term injury, like rust slowly damaging metal over many years. This brings us to the symptoms, which is where a lot of the confusion happens. Both diseases cause shortness of breath, wheezing, coughing, and chest tightness. But let's look deeper. They come and go, are often worse at night or in the early morning, and are triggered by specific things. Between attacks, a person's breathing can be completely normal. COPD symptoms, however, are constant and progressive. People experience a chronic cough, often with mucus, and their breathlessness gets worse over time. They often say, "I never feel like I can fully breathe." To understand this better, let's get a little scientific. At the cellular level in asthma, the airways are inflamed, muscles constrict, and mucus blocks airflow. But with inhalers, the inflammation reduces and the airways open up again. This process is reversible. In COPD, the tiny air sacs in your lungs, the alveoli, are destroyed. They lose their elastic recoil, causing airways to collapse when you breathe out and trapping air. This damage is permanent. Even with treatment, the lungs never fully return to their normal state. So how do doctors tell the difference? In this test, an asthma patient's airflow usually improves significantly after using a bronchodilator medication. Someone with COPD will show limited improvement. Doctors also look at your medical history, your age when symptoms started, smoking history, and any allergies. Imaging like a chest X-ray or CT scan can also be used, especially to confirm COPD. Getting the correct diagnosis is critical, because the wrong treatment leads to a worse outcome. Let's be clear, neither asthma nor COPD has a permanent cure. Asthma treatment focuses on inhaled corticosteroids, bronchodilators to open the airways, and avoiding triggers. With good management, Many people with asthma live completely normal lives. For COPD, the single most important step is to stop smoking. Treatment also includes bronchodilators, sometimes steroids, oxygen therapy, and pulmonary rehabilitation. The goal is to slow the disease's progression, not reverse the damage that's already been done. This is called asthma-COPD overlap, or ACOS. These patients need customized treatment and require close medical monitoring, which is another reminder that lung diseases are not one size fits all. Breathing is something we take for granted until it becomes difficult. Remember the key takeaways. Asthma is usually reversible inflammation. COPD is progressive and irreversible damage. If you found this video helpful, please like it, share it with someone who needs it, and subscribe to Topic Toss, because here at Topic Toss, we don't just share information, we empower understanding. Comment below and let us know what topic we should toss next. Until then, breathe easy, stay informed, and keep learning with us.